Our next session addresses the impacts of wildlife trafficking on food security and global health. Bushmeat consumption and the illegal trade in exotic pets have impacts beyond biodiversity, with consequences for local sustainable livelihoods and health. For example, with increasing habitat loss, fragmentation, and other changes in land use, there are increased opportunities for disease transmission. Also, while I assume that many of us are relatively well informed on issues with charismatic megafauna on land, I suspect that a few of us are as familiar with the challenges of combating illegal, unreported, and unregulated fishing and seafood fraud. Overall, I feel there is a fundamental relationship among illegal, unregulated, and unreported fishing with economic livelihoods and food security, including for indigenous communities, which we've already heard a little bit about in our earlier session. And I look forward to what our speakers will share with us this afternoon. For this session, our discussants include Dr. Jon Epstein from EcoHealth Alliance and Dr. Kim Reuter from Conservation International. And our keynote is Beth Kerttula, Director of the National Ocean Council, a member of the Presidential Task Force on Illegal, Unreported, and Unregulated Fishing and Seafood Fraud, also a longtime Alaska resident and Alaska state legislator before coming to the lower 48. It was my pleasure to invite her because we also share a love for Arctic science policy, which is my new focus in life. So I invite Beth to come up to the podium.
Good job on getting the Arctic in, Roberto. So my name is Beth Kerttula, and I am the director of the National Ocean Council, which is in the Executive Office of the President. As Roberto said, I'm also an Alaskan, lifelong Alaskan. I grew up on the coastline. I wound up representing a fishing community in the Alaska State Legislature. And before I begin today, I want to thank Celeste LaRue, who is our deputy at the National Ocean Council and who worked getting these remarks prepared. So thank you to Celeste. This is a great topic, and I've really enjoyed listening to the other speakers. And it's especially pertinent today because I'm going to talk a little bit about controlling illegal, unreported, and unregulated fishing. I'm going to call it IUU because otherwise I'll start stumbling over it, and seafood fraud. IUU and seafood fraud is really wildlife trafficking in the ocean. And it's not only a conservation issue, but a form, as you've heard from other speakers, of organized transnational crime with linkages to corruption, criminal networks, the arms and drug trades, and money laundering. Illegal fishing, like other forms of wildlife trafficking, undermines security across and within nations by threatening food supplies and food security and by hurting conservation efforts. Billions of people worldwide depend on fish as their primary source of animal protein or as a source of income to buy food, or as part of their cultural underpinnings, and a number of fish stocks are declining at alarming rates, in part due to IUU fishing. And, as in all forms of trafficking, IUU involves myriad and complex issues. One of the most interesting challenges of IUU and seafood fraud, and this is maybe going to seem obvious to you, but is that it's in the ocean. While the ocean covers 70% of our planet, we humans are mostly terrestrial. And when we think of wildlife trafficking, we tend to think of the iconic land-based animals that you've seen today. And it's the elephants and the rhinos without tusks and the bears without paws. So truly, one big issue is just recognizing that there is wildlife trafficking in the ocean. The fight against shark finning, which you heard a little bit about, and thank you to the speakers for that, has raised some of that awareness. And of course, so has the fight against human trafficking. But it's still easier to get people to relate to those iconic symbols than it really is to get them to relate to our fish. Other issues involve jurisdictional boundaries because, of course, species move around a lot in the ocean, the lack of data, and, of course, enforcement. Some of the same things that you've heard about. But the good news is that we're doing something about it. The United States has been a leader in global efforts to combat IUU fishing and seafood fraud and to support the sustainable management of these resources. The administration's strategic plans on wildlife trafficking, which you've heard about, and on IUU fishing and seafood fraud outline our actions internationally and domestically. For example, the United States has a fisheries enforcement regime that serves as an excellent example for other countries, and it is a foreign policy priority to persuade the international community to redouble efforts to build capacity to enhance coastal, flag, and port state enforcement measures for many reasons, including economic, health, and food security. And specifically why I was asked today, is we have a presidential task force on combating IUU fishing and seafood fraud, which is now a committee of the National Ocean Council. In June 2014, the president convened the task force. It was co-chaired by the Departments of State and Commerce, and who did a great job and are continuing to do so. And it's comprised of 12 other federal agencies to develop recommendations and a comprehensive framework of integrated programs to combat IUU fishing and seafood fraud. So one of the things that I have learned at the National Ocean Council is one of the great values of a task force like this is truly just getting all of the people who are working on similar or the same issue in one room so that you can have that synergy and you can also learn from one another how to do better. It's not always an easy task, but this group has worked extremely hard, taken a lot of input from a broad spectrum of stakeholders, and they submitted a list of 15 recommendations to the President in December 2014. Although it's broad in scope, they're targeted to address needs across local, state, federal, and international scales, with the ultimate aims of enhancing existing authorities, closing gaps in authority, strengthening interagency coordination, and fortifying partnerships, and improving seafood traceability. So recently, and online, I'm going to show you my prop, the task force published an action plan to implement these recommendations, and they outline priority actions and timelines for each of the 15 recommendations over the next 18 months. It's really very aggressive and a huge step forward in dealing with IUU fishing and seafood fraud. I'm going to talk about just a couple of the recommendations here, but I encourage you to go online and to take a look at it and to see how broad the scope of the work is. The first thing I want to talk about is the Port State Measures Agreement. It's recommendation 1, and this agreement would combat IUU fishing by setting out robust port state measures so that basically foreign flagged vessels don't land or transship IUU caught fish in their ports. It's a big problem seeing fishing vessels coming in, being able to unload the illegally caught fish. This will help stop that, and the agreement also helps harmonize port state measures globally and increases regional and international cooperation to fight IUU fishing. Enforcement at sea is often difficult and expensive, particularly, as you can imagine, in remote areas. So these port state measures are a cost-effective and efficient way to deprive IUU fishers of the economic benefit of the illegal activity, by preventing them from landing or offloading or selling their illegal catch. Recommendations 14 and 15 in the Presidential Task Force's recommendations are dealing with the traceability program. So this is all about understanding where and how your seafood was caught. It's developing a system to track seafood all through the supply chain, from harvest or the farm to market. And this is going to be a very big help to minimize fraud, to enhance food safety, and to build more confidence into the marketplace for consumers. The integrated program can facilitate data collection, sharing, and the analysis among relevant regulators and enforcement authorities, and it's a great step forward to dealing with IUU fishing. Now I want to shift just a bit to talk about the relationship of IUU fishing to sustainable fisheries, economic livelihoods, and food security, including for indigenous communities. The estimate that I've been given is that more than 2.5 billion people depend upon fish for food and nutrition. And of course, IUU fishing practices threaten this food security and sustainability and undermine efforts to reduce global hunger and malnutrition, particularly in developing countries. IUU fishing also threatens economic security, impacting livelihoods and potentially contributing to international conflict and conflicts between industrial and small-scale fishers. On a personal level, coming from Alaska, where we like to eat a lot of fish, much of our Alaska Native culture revolves around fishing and fish. I want to elaborate just a little bit on that. The Tlingit and Yupik people in southeast and northwest Alaska rely heavily on fish as a major food source, as well as part of their cultural underpinning. When fish runs are low, villages suffer. You can't just go to the local grocery store to buy an already cooked chicken or pick up a salad. You're dependent in many areas upon these resources. Omega-3 in the healthy food, very important, but it's also more than just a critical food source. It's about identity, it's about culture. When Alaska's new lieutenant governor was sworn in last year, the second Alaska Native to be elected to that spot, his clan came in before him, and at the very front of that parade in was a beautiful paddle carved with the salmon on the side. So you can see just how integrated the fish are into the culture. If you take away the fish, you threaten culture. And of course, this isn't just about Alaska. This is a situation worldwide. So IUU fishing is a global problem that threatens ocean ecosystems, sustainable fisheries, local economies, and culture. Annual global losses due to IUU fishing are estimated to be in the billions of dollars annually. And IUU and other trafficking creates and sustains a vicious cycle of poverty. When a rhino horn, I saw in some of the reading I was doing to prepare for today, when a rhino horn can cost more than cocaine or gold, you can understand the horrible incentive. And some of the fish, similarly, extremely valuable. So I want to end with some of the policies we know that are working, and to thank and encourage you all to stay involved in fighting wildlife trafficking and IUU. The U.S. government, through our domestic management regime, as well as our international diplomatic and cooperative efforts, now has significant experience in developing and implementing measures to ensure sustainable fisheries and combat IUU. And some of the work that I saw today combating wildlife trafficking on land is going to really help inform what happens in the ocean. So from that work, we've seen that there are a number of tools available. So one of the things that needs to happen and is being worked on is improving the data collection at sea, tracking fisheries products, that's traceability, so that you know from out of the ocean to the plate, and to enhancing the port security. The most successful of these policies share some similar characteristics. They're obviously based on sound science, they're supported by strong legal management and enforcement institutions, and they're developed and implemented in cooperation with communities and industry. The President's action plans on wildlife trafficking and on IUU fishing and seafood fraud use these elements as a foundation for their work. Finally, and I've heard this stated before, but I don't think it could be stated maybe strongly enough, and that is empowering local communities and indigenous people and giving them a voice in their futures is a huge part of successfully stopping trafficking and fraud. One last thing. There's a Federal Register notice. It's open until June 8. You can give public comment if you have information on it or interested. Take a look. You can comment to identify species that are at risk of IUU fishing and seafood fraud. This is one of the first steps in the recommendations of the task force so that we can have a listing of the at-risk, in this case meaning at risk of IUU or seafood fraud species. So go online, take a look, talk to me later, and I encourage you to comment if you have information. So thank you. Thank you for your interest, for your expertise. Thank you for your work against wildlife trafficking. I think many of you are very courageous. I know how dangerous it can be. And thank you for your interest in stopping IUU fishing and seafood fraud. Thank you.
Thank you, Beth. We will now invite Dr. Jon Epstein to come to the podium.
Thank you very much, and wanted to thank the organizers and AAAS fellows for inviting me to come today to speak, and also especially to thank the speakers for today. So far it's been fantastic, and I think you've all done an excellent job framing the issue. I wanted to use my time today to speak to you a little bit about the health impacts of the trade, wildlife trade, and you could bring this together in both the legal and illegal trade. Just briefly, for those of you who aren't familiar with EcoHealth Alliance, we're a nonprofit, an NGO based in New York that's a hybrid conservation and public health organization. And so we look at issues of health and emerging infectious diseases, particularly zoonoses that jump from animals into human populations and in reverse as well. And so a lot of what I'll be discussing today is the framework by which diseases emerge, particularly highlighting diseases that are driven by wildlife trade, and then talk to you a little bit about some of the programs we're developing to start to understand this better and to combat this as well. So just to begin quickly, to give you a framework in terms of how, at least how I think about disease emergence and ultimately how outbreaks become pandemics, this is relevant to this issue in terms of the interactions people have with wildlife and pathogens that exist in wildlife that may spill over. So this is really just a schematic showing 3 stages of emergence, but if you focus on the bottom stage here and think of the concept that out in nature, in any given intact ecosystem, every species of animal, just like we do, has a suite of microbes that are normal flora within its body, within the community of species. And different wildlife species interact with each other in different ways in intact ecosystems, whether it's jungle or forest or prairie, and occasionally they exchange pathogens. Now, sometimes that causes disease when that happens, and you might see an outbreak or a die-off in a new host when a pathogen jumps from one to another. Most of the time, we never notice it because there's so little surveillance done for wildlife disease. And sometimes no disease happens at all. But if you look at that first line there, that's the interface between wildlife, people, and livestock, really, and in ways that we interact with wildlife. And occasionally, humans are the recipient host of some of these wildlife microbes, whether they're viruses or bacteria or fungi. And when they get into human populations, you occasionally do see outbreaks of disease. Sometimes those outbreaks are rapid, short, and contained, explosive. And a topical example, of course, when you think about Ebola outbreaks of the past, not the current one, we had these sort of short, punctuated, contained outbreaks, largely due to the isolation of the communities in which they happened and the speed at which Ebola kind of worked its way through a community with a relatively high fatality rate. Now, occasionally, and other times, there's repeated spillover where pathogens have opportunity to get into human populations, and the right strain comes along that's able to maintain itself within a human population, become endemic. And we saw this with simian immunodeficiency virus, which famously became HIV as it spilled over from non-human primates into human communities and became a global pandemic. And then, of course, you get to the third stage. Once pathogens establish endemicity in a human population, it just takes getting on an airplane where we could be anywhere in the world within 24 hours, well within the incubation period of most of these pathogens, and carry it with us. And so, really, if we want to think about how these pandemics start, what's driving them, we focus on that interface, that initial interface that brings us into closer contact with wildlife. And the wildlife trade is one of the major drivers of emerging infectious diseases. And the example I wanted to use that I think really best illustrates this was the first global pandemic of the 21st century, and that was severe acute respiratory syndrome. SARS is a coronavirus that emerged in southern China in live animal markets, specifically due to the wildlife trade. And SARS ended up affecting 26 different countries, about 8,000 people, 800 of whom died. It's had about a 10% case fatality rate. But it really was something that spilled over from wildlife into people and then moved about the world because of human travel and human interactions. But what was really important is the concept that when you think of live animal markets, and China is by no means the only place in the world that has them, right? Very common throughout the world, but it's an example because this is the actual market where SARS emerged in Guangdong province. And when you think about it, a market is a situation where you have multiple species of animal. Some might be domestic animals like poultry or mammals that are farm raised, but in many cases you have wild animals that are brought in, not just in this case from around China, but as we've already talked about today, from all over Southeast Asia. And so you have species of animals that have been captured, put into highly stressful situations and probably carried over land, brought into these really intense, densely populated markets, usually in urban settings, where the animals are stressed. They might be shedding whatever viruses or pathogens they have. They're often stacked on top of each other in cages, and importantly, they're often slaughtered for food, butchered. And so you have people handling these animals, butchering them, typically with little or no sanitation or hygiene or personal protection, so being exposed to animal bodily fluids, and then grabbing a different species to butcher for the next customer, interacting with other people, you name it. And then as you can see in this picture, the streets are often wet because, the amount of sanitation that occurs is hosing off all the blood, guts, fur, and feathers that, are dropped on the ground during the course of the day. Also notice, there you have people eating lunch in the background and amongst this. Here's a boy who's barefoot looking into a cage, happens to be full of bats. And it was in fact the bringing bats into the market for consumption that introduced SARS coronavirus, which is a bat virus, into a market setting where it infected civets, other mammals, and ultimately people. So the wildlife trade directly contributed to the emergence of a zoonotic disease which caused the global pandemic. And this concept of bringing animals together is really one of the health risks that's understood but not very well explored and characterized. And it's something I think we need to pay more attention to as you see the global trade routes of wildlife really connect us all very closely, and the US is no exception. And in fact, this is an example of a zoonotic disease that was introduced into the United States in 2003 via the legal pet trade. This was the importation of African giant rats coming in from Gambia and were imported into southern United States as part of a pet industry. They were mixed in with prairie dogs and other North American rodents, and they were carrying monkeypox virus. The rats were the natural host, so they didn't appear to be ill, but they transmitted this virus and infected other rodents. Then these animals were disseminated to pet stores, swap meets, distributors, you name it, all the way up through the middle of the country. And the result was people who were buying prairie dogs got infected and started having clinical symptoms of pox virus. You can imagine it was pretty unsettling because the first thing you think of when you see pox lesions might be, oh my God, smallpox is back. But the CDC, who dealt with this outbreak, traced it back to the pet trade, and indeed it was monkeypox virus, something which fortunately nobody died. There were about 70 cases, but when this gets into children, particularly in Africa, it can cause severe disease, and it has a mortality rate of about 10%. So this is a pretty serious virus as well. And we brought it into the United States through the pet trade. Now, one of the challenges we face with the wildlife trade, including the pet trade here in the US, is that there are specific gaps in terms of our regulatory agencies and our ability to really conduct appropriate surveillance and prevention of pathogens coming in through legal and illegal means. And the challenge is that there are different agencies that have different mandates, and there are limitations that create these gaps. For example, CDC, who responded to this monkeypox outbreak and who has some regulatory authority over certain animal species based on the fact that they are known to carry zoonotic agents, they can regulate trade in terms of requiring permits, or they can outlaw importation as they have with African rodents, but it's by definition reactive. They can't set up a trade policy based on, say, South American rodents because we haven't had outbreaks of imported agents from those rodents yet. So they're a bit hamstrung there. U.S. Fish and Wildlife, for the incredible work they do, doesn't have the resources or mandate to look at health in addition to importation of wildlife for invasive species purposes, injurious consequences of importation of endangered species, and enforcing CITES. So this was captured nicely in a Government Accountability Office report a few years ago that examined the different federal agencies, the gaps that exist between them in terms of monitoring and surveillance for disease coming in through the wildlife trade, and put forward a list of recommendations in terms of trying to get not only improved interagency collaboration to cover these gaps, but also really recommended public-private partnerships as a way to help with that. And I think that's something that we're seeing some success with. This was really just to make the point that we don't scrutinize wildlife coming into the U.S. the same way we do livestock that's imported. There's no specific scrutiny of health issues that wildlife may have in terms of diseases they're carrying. They're not screened for viruses other than ones that might be typically known to make those particular animals sick. There's no real quarantine either at the point of export in countries of origin or coming in unless there's specific signs of disease. And there's little capacity in terms of really monitor for diseases coming in, unlike livestock, which of course, there's incredible resources put in protecting our agriculture. So there's a real discrepancy there in terms of how wildlife are treated. And this is just data from a publication showing the relative types of species or taxonomic groups that come in through the trade. Non-human primates, bats, rodents, birds represent a large chunk of animals coming in, and we know that there are species among these taxonomic groups that can carry zoonotic agents. So what are we doing to try to understand the risks involved in the trade with respect to health? At EcoHealth Alliance, we've been looking at lemurs data from the past 13, 14 years or so, aggregating that data, trying to get a broad picture of the types of species coming in. That includes fish and a lot of aquatic species, as well as mammalian species and avian species, to really get a handle on where some of the big risks are. We've been working with federal agencies like CDC and U.S. Fish and Wildlife Service to look at illegally imported bushmeat and to see if there's any health risk there. We did a study of confiscated meat both at JFK, which is a major port of entry in New York, where bushmeat tends to be confiscated, and stuff that was confiscated from a big imported case in Staten Island, New York. This was West African bushmeat. And we found evidence for viruses, some of which were zoonotic. This was genetic material from those viruses in bushmeat that was improperly cured or dried that came in with fresh parts to it, and we were able to detect viruses. So there's a risk there that we need to know more about. We're currently working with Department of Homeland Security, University of Minnesota, looking at food security and risks of importation as well, trying to do risk assessment for wildlife trade. I wanted to highlight a more global program that's funded by USAID called Emerging Pandemic Threats Predict, which is something we're a part of as part of a consortium with Wildlife Conservation Society, Smithsonian, UC Davis, and Metabiota, looking at places around the world that are particularly vulnerable to emerging zoonoses. And how this is relevant to wildlife trade is that we're focusing on pathways like live animal markets, like the wildlife trade, that can amplify and drive evolution of zoonotic pathogens as animals are brought from the wild into that market setting and moved from their country of origin into markets over land. So we're focusing on that as a driver for the generation of pathogens that could have human and livestock health consequences. Now, it was brought up, I think, earlier by Sue really nicely that consumer education and demand, decreasing demand, is an important prong to this approach in terms of limiting trade. So we're working with consumers of pets in America, putting out information to try to support people purchasing sustainably raised or acquired exotic pets. So in other words, don't get pets that are taken from the wild, but choose breeders that are breeding them domestically, or some process by which you can be assured there's a sustainable acquisition of pets. And some animals, of course, have health risks more so than others. So this is a website and app we've developed to educate the consumer. And these are messages we put out at airports like JFK and other ports around the country to also make people aware of the importance of the wildlife trade in terms of both health and conservation. So I think I'll just conclude there, but really this was just to fuel the discussion, to let you know that wildlife trade is a driver of emerging zoonoses. It does impact not only our health, but livestock health and wildlife health. There are significant surveillance and regulatory gaps that exist, but there are ways to help fill those in and to work in public-private partnerships with government agencies, both domestically and abroad. And the keys here, has been said before, are really capacity building, education on the consumer level, education at the government level, whether it's here or in other countries where wildlife trade originates, to really help to combat this and to decrease the risk of importation as well of some of these pathogens. So thank you very much for your attention, and I look forward to questions. Thanks.
Thank you, John. All right. As I get the next presentation loaded, I'd like to invite Dr. Kim Reuter. And there might be lemurs in this one. Yay.
Hi, everyone. I guess you already saw the first couple sentences of my PowerPoint if you're reading my notes. But my name is Kim Reuter, and I just graduated with my PhD from Temple University in Philadelphia, where I spent the last 4 years studying the wildlife trade in Madagascar, and that's what I'm going to talk to you guys about today. Many of the speakers today have and will discuss wildlife trafficking as it pertains to crossing international boundaries. Of course, this is very important, but I also think that it's valuable to have discussions about how this is happening domestically within the context of one country's culture and socio-political and economic landscapes. This is especially true when you're thinking about place-specific issues such as food security and global health. As we know, food security and public health are tied to these issues very, very closely. So for this reason, these studies can really inform wildlife trafficking. So today I will use Madagascar as a case study, and I will talk about first the illegal pet lemur trade in country, and then second, the wildlife trade of mammals. So Madagascar is the 4th largest island in the world, but it is also one of the poorest countries in the world. It ranks 155 out of the 198 countries on the Human Development Index. A study in the early 2000s found that 2/3 of people in the country are below the poverty threshold of consuming 2,133 calories per day. And there are also political problems, right? So there was a coup in 2009, and most non-essential aid was taken away from the country from Western donors, although aid is now returning after a democratic election in 2014. Madagascar is also a biodiversity hotspot. 97% of mammals found on the island can be found nowhere else. However, 80 to 90% of the habitat has been degraded or completely removed. So when you drive through the country, it's just savanna as far as the eye can see. So these animals that we care about for conservation reasons are basically a handful, or what seems like a handful of habitat fragments, but these habitat fragments are also useful to those people for food security reasons, as I'll talk about in a second. Wildlife trafficking is an issue in Madagascar, but surprisingly, we still don't know a lot about it. We have a lot of anecdotes and some early research, but there are many questions that still need to be answered. So first, I'm going to talk about the ongoing live capture of lemurs in the domestic in-country pet trade. I use the word trade loosely because this is an unorganized, informal process. In fact, it's so haphazard that until this spring, we didn't really even know that it was a threat to lemurs at all. In the guidebook, The Lemurs of Madagascar, there's a sentence that says, "It is likely that the domestic trade of pet lemurs is not a threat." Fortunately or unfortunately, I was able to publish a study this spring that showed that 28,000 lemurs were likely held in urban captivity between 2010 and 2013. So for comparison, there are at least 9 species that have less than 10,000 individuals left. So while this is probably not a threat to every single species, it is likely a threat to at least some. So the next question is, why are people keeping lemurs as pets? And we still don't know. So I'm doing follow-up studies on that, so feel free to ask me questions if you have questions about that. Communities know that it's illegal. About 46% of people in Madagascar, in rural Madagascar, could correctly identify that lemurs were illegal to keep as pets. The government knows it's a problem. They seem to be ramping up efforts. And we're spending millions of dollars on conservation in Madagascar, specifically on lemur outreach. But it's still happening. It doesn't seem like people are getting a lot of money out of it. This is an example of a cruise port in Madagascar where this individual had a pet ringtail lemur that he was using to get money from tourists, but he's getting a few dollars. And the monetary fine, if he's caught with a pet lemur, is $200. So people make about $250 a year in Madagascar. So clearly, enforcement's not working because people are still keeping lemurs. But yeah, the good news is that we know that it's happening. We know that it's affecting several different types of species. This is a mouse lemur that was confiscated in Madagascar and was kept in a bottle. Clearly, that's not the correct way to keep a lemur. But the reason I bring this up is because it's a great example of a trade that went essentially unnoticed because it wasn't manifesting itself in a way that Western organizations typically would notice. It wasn't crossing international borders. This is very much a domestic problem. And it wasn't being done in a formalized or legal manner. So it's not going through markets that Western scientists usually go and do their surveys at. In addition to the live capture of lemurs, I also studied hunting of lemurs and mammals in Madagascar, which occurs quite regularly. So like I said, we didn't know much about this at all, except that it was happening until 2009, when Chris Golden, whom some of you might know, published some of his first landmark studies about food security and the bushmeat trade in Madagascar. He was working in very rural, very poor villages where people had no other choice but to eat bushmeat. And so, of course, there was an uproar in the scientific community. He was bringing attention to this issue. So people started using his data and anecdotes and all kinds of stories to start funding conservation programming, usually aimed at increasing enforcement. Now there's been a move towards alternative livelihoods, but that was the gut reaction. What this meant was that whenever people saw a picture of someone hunting with a gun, which is actually an anomaly and doesn't really happen in Madagascar, they would turn around and just fund these programs without much data, even though we still didn't know how this was happening, how this was changing by animal group, who was participating. We didn't know anything about the commodity trade, and we don't know how millions of people in urban Madagascar are interacting with the bushmeat trade. So this is the capital city of Tana. Clearly, it looks a lot different than the village picture that I showed. Like I said, this is important. 32.6% of Madagascar's population is considered urban, and we had no idea how they were working with these trade networks. So answering these questions was something I tried to do with my PhD, and the results are pretty surprising. Based on a data set of almost 2,000 interviews across 21 towns and cities across the northern half of the country, we found that preference for bushmeat and taboos against bushmeat were the best predictors of consumption. So food security and access to meat was not a predictor for urban populations. In addition, we found that people in urban areas ate bushmeat at the same levels that rural people did. So they're eating the same amount of bushmeat, but for different reasons. And this was something that hadn't even been thought about in Madagascar. We also found, not surprisingly really, that the commodity chain was completely different by animal group and also different for rural communities and urban communities. I guess this isn't really surprising, but it was nice to have something on paper because now we can have targeted conservation initiatives. Finally, we found that unlike reports which suggested that wild meat consumption is rapidly increasing in Madagascar because of eroding cultural norms, we think that it is unlikely that cultural norms are eroding. We found no evidence for that, and that the consumption of bushmeat in Madagascar is increasing basically just because the population is increasing. You have more people who are eating bushmeat, but they're not changing why they eat the bushmeat. So these results basically show us that wildlife trafficking and the drivers of consumption can vastly differ within a country, and that when you're talking about the drivers of bushmeat consumption or your programming or the laws that you'd like to use to combat wildlife trafficking, it's really important to know who you're talking about. Are you talking about the rural villages that have no access, that have to walk 2 days to get to a market, or are you talking about urban areas and well-connected rural regions? In Madagascar, people will eat bushmeat if they have no choice, but they will also eat bushmeat if they want to in urban areas, even when it's more expensive than domestic meat. The Malagasy laws are not currently protecting endangered species adequately. They are not currently providing alternative livelihoods for the people who have no choice. The laws of Madagascar also don't account for preference. I'm not even sure how they would do that, but it is a really, really big hole in their strategy. I should note that bushmeat consumption in Madagascar covers 19 ethnicities, all genders, across our entire study site, which was several provinces, and various religious groups. So this is not something you can just say, well, this ethnicity is doing it. So when you no longer in these urban areas have food security as an issue, and it's not really a livelihoods issue, how do you address it? How do you address people who just want to eat it? That's a big question. So moving forward, the Malagasy government is making strides to try to finally address the bushmeat trade, although they're basing a lot of their assumptions on these early studies from rural areas, which are completely valid. There's no doubt about that. But they haven't yet integrated this new information that we have about urban areas. And so it's really hard to know if their policies will work. So that's basically all I had to say. Thank you, everyone, for taking the time to listen to my talk, and I'll answer questions later today. Thank you.
So I'd like to invite Beth and Jon to come back up and join Kim and me for our discussion. So we've heard about IUU fishing, health, bushmeat, and pet trade. Again, I remind you, so we have the 2 microphones in the aisles for questions. If you go up there, please identify yourself.
I'll go ahead. Roberto, if you don't mind. I'm Mary Blair from the American Museum of Natural History, and I have a question for Jon, really for all of you. Jon, our institutions collaborate a little bit, so.
That's right.
So my question is about the live animal markets. I work in Vietnam, and some of these markets, they've been around for hundreds of years. So what's different about what's happening now in the live animal markets? And I wonder if you can relate that not just to globalization, but other processes as well.
Sure. Is this on? Yes. Okay. One of these microphones doesn't work, probably mine. One of the things that's probably different now about 100 years ago, 50 years ago, is our ability to recognize some of these pathogens that are emerging. And we're starting to conduct surveillance, starting to trace back outbreaks to wildlife sources. So while the rate of emergence is increasing, even despite our technology and ability to detect them, I think we're recognizing more and more some of these drivers. So I don't think this is something that never happened in the past. I think it probably went unrecognized. Now, there are probably other differences that are happening as wildlife becomes more scarce. It comes from further and further away, probably under more stressful conditions. Urban markets are serving a larger population, so you might have higher human population density surrounding urban markets that allows for broader spread than if this was happening in a more remote community or rural community. So urbanization plays a role in this as well. And that might be some of the things, those might be some things that account for differences we're seeing. Other comments?
Does Beth or Kim want to add anything to that?
That sounds pretty much, yeah.
Okay.
Question.
You want another question?
Hi, my name is Ming Ming Lee. I'm from working at Princeton. So the question is for Kim. Thank you for a very interesting talk. So I also worked on preference. In this case, preference for keeping wild songbirds in Sumatra. So I was just wondering, it seems like almost everybody's eating, but did you actually ask like what is the main reason why they are eating? I guess you did, but then if they're willing to give it all up, what would take it? I mean, what would be the main reason why they would stop eating the lemurs, for instance, or bushmeat? Did you ask that? Because the other thing that I did, which is a little bit different, I guess, I actually asked people. So in Sumatra, what's interesting is that you have people who keep wild birds, and then you also have people who keep captive reared birds. So then I'm able to sort of differentiate, these 2 different groups, what is actually driving that. And they have different drivers behind their decisions. It's actually fascinating. So just wondering if you could comment on that.
So the reason why people stopped eating bushmeat, and we asked about specific animal groups, it was kind of surprising. I expected, deep answers, but it was basically like, my doctor told me to stop eating meat because of cholesterol, which was like a real thing. And for some animals like wild pig, that was their main reason. And the other one was marrying into a different ethnic group. So you take on the taboos of your husband, or if you're, it was mostly women taking on the taboos of their husband, or the husband bringing children into the marriage who had taboos from their relatives. So that's why they would stop. Did that answer your question mostly? Yeah, okay.
Some others? Well, I have a question for Beth, actually. So going back to Alaska and coastal communities and sustainable fisheries, maybe you can tell us a little bit more about some of the other recommendations that are in the action plan that you feel are sort of widely applicable to.
One of the interesting ones for me is working with the intelligence community and Homeland Security to the extent that they can be able to use the methods to try to have the information so that we can use it against illegal fishing. There's a lot of information, there's a lot of methodology. So that was interesting to me coming out of the task force. And the methods of being able to track, we say we know more about Mars in some ways than we know about the ocean, but being able to track vessels, being able to, understand what's on them, it's all a big issue. And it's great to be able to follow in the footsteps of some of the wonderful work that's being done in the wildlife.
Yes, we have a question.
Hi, thanks everybody for your great talks. My name is P.T. Panchin. I'm currently with, excuse me, with USAID in the climate office there. And I had a question about monitoring specifically at the borders. And so domestically, we've got the U.S. Fish and Wildlife Service that runs the program, and they're chronically underfunded to be able to really have robust programs to monitor everything, right? So given the resource limitations, I'm curious if you have any insights as to how we could use modeling or other types of information analysis to best optimize and put our efforts to really effectively detect wildlife as it comes into the borders.
I can start with this one. I mean, it's a great question. Like anything where there's limited resources, you have to be strategic about how you deploy them. So a few things we understand about the importation of wildlife in the United States is that there are certain key points of entry or ports of entry. New York, Los Angeles, Miami, these tend to be major areas where wildlife is coming through. And so that would be a natural place to start. But we also just don't know the extent to which animals are coming in terms of diversity. As we learn more about the diversity of taxonomic groups that are coming in relative quantities, which is what we're hoping to do by analyzing that 15 years of lemurs data to really get a better sense of what are the major taxonomic groups. We know fish is one of them, coming through. How to focus on quarantine and screening efforts, but beyond strategic targeting, we also have to, I think, free up some of these agencies to develop expertise and human resources to do some of and technical resources to do some of the disease screening. I mean, one of the problems is not solely about limited resources, but structure of mandate, where certain agencies just aren't supposed to do that, and so they don't, and other agencies also don't or do it for different reasons. So filling in some of those gaps in a strategic way will be important too. But to answer your question more specifically about modeling, I think we can start to target locations, we can start to target specific types of animals or bushmeat that is coming in that we are starting to know have pathogens of interest that could be a threat, and focusing efforts there to detect those.
This is part of that effort in terms of the Federal Register, looking for the species at risk of IUU or illegal fishing. Once we get the information and can start seeing what you should be tracking, it should make things a lot easier for the fish. I also agree on the ports, and obviously there is a lot of enforcement there, but just being able to do the traceability in terms of from the harvest to entry into the U.S. is part of the whole IUU fishing effort.
So would it also be valuable to include other agencies like Homeland Security or Transportation, Customs and Border Patrol, TSA, all those folks, everyone, to have them?
Yeah, Port Authority's been involved, Department of Homeland Security is involved for sure. Yeah, everybody feels that this is an important issue, so.
Kim, do you want to add anything?
I mean, all of the things that you guys are talking about are definitely relevant for tracking of domestic trade. I think the biggest problem in Madagascar is that you have this international trade of reptiles and amphibians, which has all of the same problems that everyone's been talking about. But then you have these high value animals, like high value both for conservative value and also monetarily, actually, lemurs. You have tens of thousands, and we just don't know. We don't have an easy port. We don't have, not that it's easy when you have 5 ports, we don't have one location that we can start with. But we can definitely take the tools that we've learned from cross-border trading.
Okay.
Actually, I have a question for you, Beth, if I may. Oh, I'm sorry. Well, maybe we should start out there.
Oh, sorry, I just had a quick comment. My name's Allison Thiem, and I'm with the Smithsonian. And I recently attended a talk at the American Association of Geographers, and it was actually related to all 3 of your topics. And what it was looking at potential sources of why the most recent Ebola outbreak has been different from previous ones. And it was looking at the increased need for bushmeat, and that was actually related to the fish trade, taking fish out of the Ghanaian Gulf and moving that towards Europe and Western markets. And that also increased the need for bushmeat, but also illegal logging was, and legal logging was actually increasing the roads and the access to different bushmeats that are further and further into the forest. So it was just kind of an interesting connection of all 3 of your topics.
Yeah, That's a great comment. And if I could just make an additional comment to that, I think what's been interesting about this whole outbreak is that despite, the trigger was certainly contact with wildlife and bushmeat, but I think a lot of the science has shown that this outbreak began from a single spillover event. So this wasn't, 50 or 100 people getting exposed to Ebola from an animal reservoir. It was potentially one person who then spread it to a village, and then it was human dynamics, movement, social dynamics, behavior that led to this being such a large outbreak. So for sure, we need to understand some of the behavioral risks associated with wildlife hunting and bushmeat consumption, but this outbreak is so large and so unprecedented, more so because of human social dynamics and connectivity than it was necessarily because of spillover occurring.
Just to add on that, though, totally agree, but it does raise the point that it is important to know what the drivers of bushmeat consumption are.
For sure.
Because if you don't know that it's connected to fisheries and somehow to the illegal timber trade or legal timber trade, you can't possibly even start to address the issue. So
That's an excellent point.
yeah.
And the more I work on ocean issues, the more I just realize the interconnectedness of it all, right, in terms of the entire planet. But in the ocean, so if you wipe out a certain species, what the impacts are just keep rolling on and roll on, to us and to everything, so.
That's a good point. Let's go to the side.
So my name is Dan Hubble. I work for the Environmental Investigation Agency. I had a quick question for Beth, actually, very connected to Alaska. As sea ice coverage in the summers decreases, do you anticipate IUU in the Arctic becoming a much broader topic? And how do you anticipate collaborating on enforcement, if so?
So I'm glad you asked the question because I want to make it really clear. U.S. fisheries domestically are really well regulated. And in Alaska, you just have some of the best regulation possible, and of course, so much of your own fish that you get yourself. So it's a completely different system, and we've learned a lot domestically that we can also, use internationally. But the question on the Arctic about the sea ice changing, there's just so many changes happening in the Arctic that it's just very difficult to predict. Hopefully this task force and the IUU measures that come out of it are going to be able to stop something like that from happening, but it's really impossible to predict. We certainly, we do well domestically. Hopefully we can impact the world scene.
Thank you.
Yes, please.
Hi, my name is Jennifer Howard. I'm with Conservation International. I see Kim in the hallways sometimes, but I'll have to take you to coffee because I want to pick your brains some more. And I'm also really pleased to see that fish are and oceans are being considered along with the subject matter. I feel like they often get forgotten, so I'm very excited about the symposium, being sure to bring them into the fold. That said, my question is mostly for Jon, and I want to be sure I hit up everybody. So Jon, one thing that I've been thinking a lot about is, we can try to improve technology for tracking and finding sources of illegal trade, but much like a lot of illegal activity, it's the demand and the money that really drives it, and we can show these horrible photos that really pull at your heartstrings, but I was wondering if you've had any metrics on the impact of actually showing the health implications to decrease demand.
Yeah, that's a fantastic question. I think we believe strongly that health is an important angle here, and it's a relatively new one. In terms of leveraging human health or livestock health against conservation, it's a relatively new area of science to bring to bear. And I'm not sure that there are metrics yet to really show how this is impacting things, but I think that one of the metrics I could give you, or one of, at least anecdotally I could tell you, is that we've seen really tremendous buy-in from governments in the countries we're working in, particularly under the USAID PREDICT program, or Emerging Pandemic Threats program, where we're working with wildlife agencies, wildlife authorities, to talk about the risks of wildlife trade, of hunting, of contact with wildlife to health and to livestock health. And we're working not just with them, but also ministries of health and agriculture, so that sort of triumvirate. And we're seeing buy-in from the government, where they're starting to put their own resources into developing diagnostic capacity for detection, human resource capacity for surveillance of wildlife. And for the first time, wildlife agencies are at the table on health issues. And that's something that hasn't happened before because they've typically been relegated to ecotourism issues or hunting licenses, and that was the source of revenue. But suddenly now they're being asked to take responsibility for wildlife health and public health. And I think that may have a measurable impact down the road in terms of perhaps wildlife trade or wildlife consumption. But I think those metrics still need to be, or the data still has to come in on that.
Yeah, thanks.
Great question.
I actually have a question for you.
Do it, please. Yeah, we have a couple minutes.
When you say that it's recently, becoming part of the conversation, what do you mean by recent, and how has it changed the landscape? How is when you say the governments are buying into this idea?
Yeah.
What shift do you specifically? What shift are you seeing?
I think more traditionally, when we think about conservation, and it's a field that for decades and decades has been working to protect wildlife and ecosystems and landscapes. And often the argument is there are economic reasons for that, or it's important for the sake of preserving biodiversity. And those are the arguments that struggle. I mean, they sometimes work, but they often aren't powerful enough because of the counter argument that always is people have to feed their family and people need money, and it's more valuable to have a rhino horn than a live rhino. And so it's always challenging. I would say probably within the past 2 decades, this has been an evolving field where conservation medicine, One Health, the concept of integrating the connection or bringing up the connection between human health, livestock health, and wildlife in the context of environment and ecosystem is something that has really gained momentum just in the past 15 years or 20 years. And so bringing that to bear on conservation efforts by talking about how if you cut down a forest or you increase your contact with wildlife in that intact forest, you actually could be at risk of a pandemic or an outbreak. And that's a fairly new area, I think, of research in terms of bringing that to the conversation. And that's what I mean when I say that wildlife authorities in some of these countries that are places vulnerable to emerging diseases are now starting to have a seat at the table with public health.
Great.
And that's something they haven't done really historically.
Awesome.
It's pretty new.
Let's take one last question.
Thank you, Roberto. Thank you all for great talks. My name is Alexis Irwin. I'm a first-year fellow at the USAID Bureau for Africa Environment Team. My question is an invitation to all of you. In the United States, of course, we have very quick and efficient systems for dealing with food scares, threats to our food system, threats to human health. There can be regional immediate recalls, for example. I wonder whether there are any lessons to be learned from the situation in the United States in terms of communicating the very personal and immediate threat of consuming bushmeat to an individual. I mean, what might we learn from FDA's efforts or the CDC's efforts to communicate those risks that could make sense in Southeast Asia or African settings?
I mean,
Wow.
if I think in the context or the landscape of Madagascar, I'm not even sure that would work. I think there's a lot of mistrust of Westerners. There's a lot of mistrust of anything from France, first of all. There's, yeah, I know, I had to be like, I'm American. It's the first time that was a good thing for me overseas. No, but seriously, I don't know that it would work. I think in Madagascar, you have to talk in the context of taboos, and you have to use local belief system. And I know that sounds silly, but if you say, I have this paper that tells all these facts, and there was an Ebola crisis in Central West Africa, so don't eat bats. People are going to be like, oh, this is made up. They don't like, a little tangent, I also study public health problems for university students, and a lot of them, 27% of them, do not believe that HIV is real. So these are some of the most well-educated people in the country. So I don't know, I don't even think I answered your question of how I would use it, because the answer is I don't know if we could. But so maybe you guys have an answer.
My perspective is there are things we do well in this country, but let's also remember sometimes we struggle with communication when it comes to public health. I mean, recalls in food are one thing, but look at our struggle with vaccination recently and understanding the issues about, a very well understood process in terms of protecting against an infectious disease, and very educated communities in the country who are making decisions, counter to that. Or, more back to the wildlife issue, we eat bushmeat in America. We call it game. You know, there's hunting all across the country, and there are hunters and communities of hunters who don't necessarily change their practices despite, you know, there being potential health concerns or risk. And, you know, I was just in Illinois, and we're talking about chronic wasting disease, and although there aren't necessarily direct links yet to human health impacts with consuming venison that might be infected, there are people hunting and eating elk or deer knowing that they are infected with prion, and we're not quite clear on what the health impacts would be. So, you know, communication is there, behavior change is a challenge no matter where you are, and I think that's a risk at home and abroad. So just last comment to your point is, whatever we do in terms of communications, I think the lessons are information has to be presented in a culturally appropriate and sensitive context, especially, you know, overseas. So it's tough to come in and just say this is a risk, but it has to be done with extreme sensitivity to local customs and local context.
A final word?
No, that was
That was it.
Sorry.
It's not quite, you know, on point with IUU, but definitely being sure that you're communicating correctly within the culture is a big part of it.
Great, thank you very much. Let's check our speakers.